See, the medical education scenario in the India is growing and expanding and evolving. There are two reasons for that. One is that the healthcare industry itself is expanding. If you look at the needs which were there of the people about 2 decades back and now, there are a lot of changes in the expectations of the people and the healthcare level they want. So there is a expanding and evolving healthcare industry. I would like to say today India is one of the major human health resource provider, not only to our country but also to many other countries in the neighboring region and even overseas. Our health professionals, be medical doctors, dentists, pharmacists, nurses, physiotherapists, are required all over the world, plus the country's needs. And there is a strong desire among the students that they would like to be a part of the health profession. After seeing that they are being in the IT industry evolution, they feel again coming back, the student trend mindset to be a part of health profession is again there in the increase. So all this shows that medical education is set to grow. Medical education is something which needs to be nourished, cherished and developed. So all stakeholders in this, that is the students, the government, the institutions, all have to work to really capitalize on this opportunity. See, our priority right from the day the JSS University was established was to give a lot of emphasis to research and interdisciplinary research. That was one of our major focus. See, we were all standalone colleges earlier, like medical college, dental college, pharmacy college, we were standalone. When we became a university, we all came together and we said, can we work together? Can we do something together? Can we nurture life sciences in the medical college? I mean, usually what happens is when you ask a medical doctor to pursue research in physiology, he may not be excited about it because he does not find immediately the clinical application which may be benefiting. Whereas a life sciences graduate would be happy to get into it and learn to the physiological process and try to do some research which can benefit the application process at the end. So we said we should integrate the the information of health sciences that is there and bring interdisciplinary research. That was one of our focus. And the second focus was to see how we can enhance the teaching learning process to the students, and that's where you can see all our lecture theatres and all our things are all audio visual or of the latest technology, so that smart classrooms are there. Students can just teachers can go and use that smart classroom to communicate to the students that is required, and we want to make it much more interactive over a period of time. The idea is, though attendance is compulsory in health profession, but still can a student be able to listen to a lecture due to whatever health reason he may not be able to attend a lecture on that day? Can he still be at home and listen to the lecture which the teacher is giving and gain advantage of it, or re-listen again? So these things is on our mind, how to make the teaching learning further develop. And the last focus was on innovation. I mean, innovation in curriculum, innovative curriculums can be developed, interdisciplinary curriculum to bring some newer emerging areas. So that has been our main efforts, and we are working towards that. Now, bridging this between the reality in the society and orienting the training towards that perspective is the responsibility of the individual institutions, and that's what JSS University is doing. Like today, the anatomy curriculum in the medical council syllabus says that you have to teach human anatomy to the person. When there were no digital era, so people used to use the human cadaver itself for teaching purposes and then move forward to train the students. Now then came the models to be used instead of human cadavers. Now it's a digital era. With digital era, you can even do sophisticated surgical skills can be trained on online. So nowhere the medical council says that you should not teach anatomy using digital and you have to use only cadaver. Cadaver is the foundation. You can always teach them with the digital technology using these things. So these gaps needs to be filled up by the institutions. We have to evolve ourselves in delivering the knowledge to the students. It is not that we are talking of doing away with the face-to-face contact with the student. No, that's not the question when we talk of virtual era or digitalization. How do we deliver the same content to the student in a different format? The Pharmacy Council of India 2008, they introduced what we call as the Doctor of Pharmacy program. It is known as PharmD program. That is more clinically oriented pharmacy program. That Doctor of Pharmacy program produces the clinically trained pharmacists, and these clinically trained pharmacists would be available as a supportive mechanism to the physician. They will help the physician in working with him and seeing patient compliance on the medication whether he has taken. Then number two, any adverse drug reaction that has been visible, which normally a nurse may not be able to immediately say. Then number three is advising and counseling the patients on medication, what they should do and what they should not do, providing drug information, then adding pharmacovigilance data to the national database as well as to the global databases. So all these are required to be provided. So that's why the Pharmacy Council of India discussed about this, and we introduced this Doctor of Pharmacy program. One of the major programs is that this course can be started only if you have a tie-up with a 300-bed hospital. So without that you cannot do. So today directly there are about 130 institutions which are offering this program. So that means 130 hospitals are benefited by this type of care which we are talking. So now what is happening is we have emphasized to the Health Ministry and also asked that almost all corporate hospitals need to introduce pharmacovigilance systems where medication becomes a thing, where they should have a clinical pharmacist who can work with the physician and help the physician in many of these issues. The simple fact I will tell you, if there is a properly trained clinical pharmacist available with the physician, and if the medication is managed properly, the reduced stay of the patient is there in the hospital. Okay, so automatically the costs are reduced for the government, and for where you spend about a patient staying there for 10 days in the hospital, he will be staying for 3 days if he gets the right type of medicine, and he goes back. Thank you very much, and I wish your DoctorPulse very success, and my best wishes to you, all of you.